Hello. Hello, good morning, everyone. Thank you, Lillian and Andy, for the excellent opening remarks. And also, thank you for the chance, for the opportunity for me to speak to each of you here as one of the first three speakers of today. And I'm glad also that I can be here physically to introduce you about my company as well as our unique venture accelerator programs. So before talking about my company, just a very brief introduction about myself and my colleagues. So my name is Ken, I'm from Brinc, which is a unique breed of venture accelerator, which invest and support startups globally. The healthcare and MedTech program in our company is relatively new, but nevertheless, our top management has managed to compile a very experienced and international team, as you can see here. So before going into the program itself, let me also talk to you very briefly about Brinc. So it has been established in 2014 in Hong Kong, and what we are looking for are game changers that can fundamentally affect how we live our lives, how we feel our environment, what food we eat, where we live, and as well as how we move from places to places. And these four visions then translates into the focus investment verticals of Brinc, which is shown on the top right corner, meaning the healthcare and MedTech sector, hardware, electronics, Internet of Things, food tech, agricultural technology, sustainability, as well as green tech. So, so far, our company's Brinc has already invested in more than 200 startups, which are originated from 38 countries. So here is examples of the invested companies of different subverticals by our companies. So for MedTech and healthcare, we have, although I said it's relatively new, we have already invested in around 30 healthcare and MedTech companies, spreading from bioprinting, medical devices, digital solutions for surgeries, as well as smart solutions for hospital operation management, etc. So to empower the success of the invested companies, Brinc have been working very hard to build a ecosystem around our different accelerator programs. So we work very hard with large corporates, traditional VCs, as well as other ecosystem stakeholders. So to build an ecosystem that can empower the startups invested by both Brinc and our collaborators. So here is just an example to show how the large corporates and traditional VCs engage and entrust Brinc to source for elite startups. Showing on the left is one accelerator program targeting companies on gaming and metaverse, etc. This is sponsored by Animoca, which is also at the same time a lead investor of the Series B funding for Brinc itself. Next to it is an collaborative effort with Lever VC, which focus on sourcing excellent food tech startups in mainland China region. And showing on the right are two more recent programs collaborated with large corporates. One is an accelerator program collaborating with a French-listed corporate, Schneider Electric. And the other one on the right side is a more recent program that we work with Day Coke, which is a pre-IPO stage direct-to-consumer company providing health and innovative meal options for the customers. So going back to the focus of my talk, as well as the main theme of today's summit, which is MedTech and healthcare, what Brinc is actually looking for are game-changing startups that can change, that can impact every stages of a patient's journey. So from traditional verticals like development of new drugs, diagnostic risk identification of disease development, as well as medical device and women's health, to some other emerging subverticals like digital solutions for drug discoveries, hospital management, etc., and even to food technologies that can assist us from preventing disease development to post-treatment recoveries. So another point that I would like to highlight about is that apart from looking for game changers that target directly the patients, we are also interested in companies that target also directly those healthcare conscious individuals, as well as those targeting directly the healthcare professionals, as well as the family caretakers of the patients. So, so you see the patient's journey is very sophisticated, complicated, and involves many, many different kinds of technologies. So from the point of view of an investor, what should we focus on? On one hand, we are looking to companies that can maximize our return of investment. But on the other hand, we will also like to address the unmet needs of the patients. So allow me to present here a highlight of our investment thesis, talking about what we see as the focus disease areas, as well as what we see as the unmet need from the patients, as well as what is going on in the recent couple of years in terms of markets and the investor environment. So on the left side is talking about the focusing disease areas, like the disease related to the heart and metabolic disease, cancer, neurodegenerative disease, as well as mental health disorders and infectious disease. So I'm not going to talk about the driving force of this disease area in the traditional verticals like drug development and diagnosis, because due to time constraint first, and secondly because we have a very excellent lineups of speakers, experts, and audience today. So I'm not going to go into details here, but still I would like to take a few minutes to go through some of the others focusing subverticals within the MedTech and healthcare sections. So the first one is medical device. We are looking for especially those can not only deliver efficient therapeutic options to the patient, but also that can really enhance the experience of the patients during and after treatment, especially those suffering from heart or lung-related diseases. So, and commercially, I would like to very quickly share an insight about the company listed in Hong Kong through the Chapter 18A, because last year, the proportion of companies approved for listing through this program in Hong Kong last year, the number of companies focusing on medical device has been rising to almost 50%, which is a number that is similar to those focusing on traditional drug development companies. So you can see the uprising trend of both investor appetite and the market needs for companies focusing on medical device. The next subverticals that we are interested in is the artificial intelligence, especially those can have applications in different sectors of healthcare, like drug discovery, that is what in silico medicine is doing, as well as those that can apply to risk identification of disease development, clinical diagnosis, as well as the use of the same technology on different aspects of management of hospital operation. we are also interested in technologies that will empower the data collection and analysis of drug safety surveillance. So talking about digital solutions, another emerging subverticals that we are interested in will be digital therapeutics. So initially, maybe you think that it is because of it is an emerging subverticals because of the inefficient treatment option and early detections for numerous neurodegenerative disease, psychological, as well as psychiatric disease. But what we observe is more than that. We observe also the emerging research product pipelines covering non-neuro related diseases like obesity and pain management by the use of digital therapeutic technologies. So you see, digital healthcare is the next big wave. So as a pioneering venture accelerator, Brinc is also interested in companies that will be using other cutting-edge technologies to apply in healthcare settings, like those use of blockchain, Web3, as well as even metaverse. So I'm not talking about this in detail because in the afternoon there will be another interesting session covered by my colleague, Joseph. So stay behind after lunch for this interesting talk. So you see there is a very complicated MedTech and healthcare is a very complicated sector. So for the startup we invested in, we have to offer a very comprehensive support for them, so that they can grow and to get to both the good return of investment as well as to really address the unmet need of the patients. So what we offer is a very comprehensive program. Shown here is an example of basic program structure of Brinc. So from the application process, due diligence, pre-acceleration process, as well as post-investments. So they will, a company will be, have the chance to assess the basic, for example, more than 100 educational modules that cover a mixture of funding, education, and support for their different challenging milestones when they grow during their startup journey. So as I said, again, MedTech and healthcare is a very, very complicated sector and has a long and sophisticated value chain. So we are also working very hard to provide additional support to our supported invested companies. So showing here is our effort is to expand the network of advisors, mentors, and other stakeholders of the ecosystem to our invested companies. So yeah, they are meaning that they have the chance to access to this wide network of advisors, mentors, and ecosystem players. And shown at the bottom left corner are 3 examples of mentors that our invested company has the chance to tap into. So talking too much about what we are focusing on and about the program. So is there, what are the details of our MedTech and Healthcare Accelerator program? So to be honest, we are still continuously updating the important information about this accelerator, but here is a glimpse of what the Healthcare and MedTech Accelerator is about from Brinc. So one important point is, apart from the how much we invest, another important point is that we invest internationally. So first, we don't only focus on startups in the region, but also those from overseas, from the US, from Europe, etc. But also, we do not require the startups to relocate or have really physical teams here in the Hong Kong region. So because it is still continuously updating, so please stay tuned in our social media, either in our webpage or LinkedIn. So that's all for my sharing today. So if you have any question or want to know about Brinc and our accelerator program, please be stay in touch. Thank you.